For next concept we should discuss, we'll talk about neonatal sepsis. Neonatal sepsis. So sepsis itself just have to do with a widespread blood infection. Alright, so maybe bacteria or some crazy things are actually stepping into blood to cause a lot of issues, so it's just a life-threatening condition in newborns, right? It's caused by systemic infection. So the infection is stepping into the bloodstream, and the bloodstream is now serving as what? A transport to now spread it all around. So this infection typically occurs within the first 28 days. So when you give birth to a baby, it's within the first 28 days, I'll be the first month, that we can still call it a newborn, So any infection, any widespread infection within that time is what is known as a neonatal sepsis. So it's a major contributor to neonatal morbidity and mortality. It can make your baby die. Okay. So types, you have early onset. This one is just within 3 days that you give birth to the baby. Organisms that usually cause this: group B Streptococcus, Escherichia coli, Listeria. Then the late onset, that one is at least it left, after the first 3 days. So organisms that can cause those is you should have the Coagulase-negative, like Staphylococci, okay, Staph aureus, Candida albicans, Klebsiella. So risk factors: what will make you likely to have this infection? Alright, that's what will make the baby likely to have this infection. If the baby was born prematurely, so many things in the baby have not developed to what they expected, including the immune system. Alright, low birth weight, prolonged rupture of membranes, maternal infections, invasive procedures, alright, during the time of birth, poor hygiene, alright, the area around is not really clean and all of that. So signs and symptoms is this: temperature instability, okay, so fever, hypothermia, poor feeding and lethargy, respiratory distress and apnea, jaundice, seizures, okay, abdominal distension, bradycardia, maybe the heartbeat is very slow, maybe the heartbeat is very fast. Any of these can indicate that there is a problem. Alright. Diagnosis is blood cultures, lumbar puncture for CSF analysis, urine cultures, alright, complete blood count, alright, testing for C-reactive proteins and all of that. Treatment: if it is infections, use antibiotics is the mainstay. So ampicillin, gentamicin, cefotaxime. Then you adjust based on what you got from the blood culture result. Okay. Supportive care is like what? Intravenous fluid, oxygen, just to resuscitate. And you can take the baby to what? The neonatal intensive care unit if the issue requires a one-on-one attention.